According to the 1948 Universal Declaration of Human Rights, everyone is entitled to have an adequate standard of living, regardless of race, religion, political belief, and economic or social condition. To achieve and enjoy the adequate standard of living, everyone has the right to health, which means that everyone should have access to health services that they need without suffering from financial hardships. As stated by the Director General of the World Health Organization in an article published about Human Rights Day in 2017, no one should get sick and die just because they are poor, or because they cannot access the health services they need. This means that health services must be inclusive. Everyone is entitled to have an opportunity to access health services without discrimination to achieve a healthy life. Health services are medical health services that are given to ensure the optimum health and wellness are achieved. This may pertain to different activities done to ensure the health of people in communities, such as annual physicals, laboratory testings, condition screenings, treatments and immunizations, maternal and child care, dental care, access to medicine, reproductive, sexual, and mental health, among others. Access to health services are not only limited to this. An access to healthcare also includes access to information about the different facets of health. Health services to the people should be holistic and people-centered. Holistic health care means that it should cover all dimensions of health and should include services ranging from preventive health care, promotive health care, treatment of communicable and non-communicable diseases, to rehabilitative health care, and by people-centered. Health should be accessible and for the people. In an effort to make health services accessible, health services are brought down to community levels. The health department is making an effort to bring health care services to the people in the forms of rural and community health centers. Providing health care services is a two-way process. 1. Quality health care service should be provided to the people. And 2. Community engagement is necessary to ensure that the health care services reach everyone. Mobilization of communities are being encouraged to ensure that health services are accessible to everyone. As the youth, we are capable of catalyzing development within communities to bring health services closer to people. As future leaders of communities and the country, the youth has the responsibility to become a bridge for the people. The youth can become an agent to introduce health services to the communities.
According to the Department of Health, there is an act which guarantees the availability of health services in the Philippines. This act is known as Universal Healthcare Act or the Republic Act 1122. It was signed by President Rodrigo Roa Duterte last February 20, 2019. This act will ensure that all Filipinos have adequate access to high-quality, accessible healthcare products and services while protecting them from financial harm. It seeks to reduce Filipinos' out-of-pocket expenditures. Also, this act would therefore guarantee that the cost of healthcare products and services are stable and sustainable. There are some programs that were offered to every Filipino in order to ensure the delivery of a quality service, such as the Family Health Program. It seeks to improve each family member's health and well-being, as well as to reduce morbidity and mortality rates in the family and community. The maternal health, family planning, child health, expanded immunization, nutrition, and oral health programs are all part of this. These programs were offered in all parts of the country through their local government units. The government is focusing on investments in health services, infrastructures, and human capital in hard-to-reach areas under this Universal Healthcare Act. The frontline healthcare services would be improved in the primary care-focused health system, ensuring that every Filipino has a trustworthy primary care, because they will provide the basic health services that are needed. If higher level of healthcare service are required, the primary care provider will refer their patients to appropriate healthcare provider. Hospital can influence the nature of healthcare facilities by allowing them to concentrate on more complex cases by offering a clinical leadership and guidance.
So how important is our role in the community? Each role has a specific job. Significant or not, each role has a major contribution to the community. A community would not be complete when one role is missing. Like a body, each organ has a specific role and contribution that makes a whole. Our role as the youth is to create change. As part of the youth, we adapt easier, and we could apply these newly adapted skills in the community. An example would be technological skills. As part of the youth, we are quick to learn technological skills that would be very beneficial for the community by means of creating informative videos or posters that could increase in awareness and increase the knowledge within the community. Starting to participate in the community is also our role as the youth. We, as medical technology students, could help by applying our newly adapted knowledge and skills by helping the professionals in health services. We may be students, but that does not mean that we should not help. As early as being in college, we must already start to participate, involve ourselves, and expose ourselves in the community. In our future profession, we could apply these skills to further improve ourselves. We have to start early so that we can further improve and make the best out of ourselves when helping the community.
According to the Merriam-Webster Dictionary, a humanitarian person is the one who does deeds in order to improve lives and the condition of other people. A humanitarian person is concerned with the other people around him or her by giving them help to provide happiness or relief in times of suffering, by means of doing good work, or by giving time or money to show his or her care. Humanitarian action can be shown on any scale, either big or small. Humanitarian action are also aligned with the principle of humanity, which have the purpose of saving lives and mitigating suffering among fellow men. As reiterated by UNICEF, adolescents like us are essential in contributing to any stages of humanitarian actions. Our knowledge and skills are a big help, especially in social dynamics and in helping prepare, respond, and recover from man-made calamities. The first-hand experience we adolescents have can give a huge solution for the country's resilience, stability, and peace building. Our generation is much bigger than the past generation, in which we possess more resiliency and can become the positive agents of change in our community. Walton and Hazel Corn stated that practicing information and communication together with their tools is one of the key factors in humanitarian service activities, especially in healthcare delivery system. One example of which the information and communication strategies that help meet the medical needs of the people. Our skills can help establish effective and sustainable humanitarian system. Good information and communication will improve the services we will render to our community. An example we can relate to this is Walton and then Renby's value-sensitive design approach, which help in developing health information system of rural areas in Africa. Furthermore, as college student, we can serve our community in order to promote humanitarian action by these ways. We can donate blood, which refers to the Republic Act of 7719 that promotes voluntary blood donation to provide sufficient supply of safe blood and to regulate blood banks. Offer food or other items in our community pantry. We can organize a visit to an orphanage or to a home for the ages. We can participate in advocacies, or we can donate or volunteer to a charity in our community. In serving the community, We must become selfless and sacrifice our time and efforts. In addition, our main purpose is to instill happiness, to lessen the suffering of our fellow men, and to make others people's lives better. With these ways, we can also learn more about ourselves and about the people around us. In this time of pandemic, we can still serve our community with the practices of social distancing, wearing a face mask, and face shields. We can always have our own ways in serving our community to promote humanitarian action. It only depends on each of us on how we will conduct it with only one purpose.
According to the World Health Organization, community mobilization is a strategy that assists communities in identifying and responding to their own needs, which is a significant strategy for expanding the implementation, especially the utilization of healthcare. Some of its impacts include:
first, it gives awareness about health and other social issues. Second, it acts as a motivation to the community to have community preparation, organizational development, and involvement. Third, to have allies within and outside the community to meet the common goal. Fourth, to share relevant information and communication in the community. Lastly, in supporting the community members by providing incentives as well as by helping them in generating the community resources.
In today's generation, the youth have a significant part in having community mobilization. They have a role as a catalyst for change and as a bridge to a different generation. As stated by Connor and Stovell, as the national and international social concerns emerge, the demand for social change leaders grows. At the same time, the digital age has dramatically increased the opportunities for youth to organize, communicate, and be involved in the things that should be addressed. Despite the negative implication about the youth brought by social media, we can't deny that the participation of the young generation in social transformation can offer us valuable lessons and information. Young people are participating in community mobilization in a variety of ways. Using social media, they were able to develop, spread, and promote a movement that is relevant in the present situation. They can make an important and creative contribution to raising awareness as well as mobilizing energies to address community issues. Over time, the youth proves that they can also be a driving force for action in diverse social and cultural settings. Therefore, empowering the youth is a significant preparation for greater action and involvement in the future. We should remember that community well-being is a responsibility of everyone, because no leader can achieve anything great all alone. Community mobilization is one way to empower community members to create stronger and more connected communities. Most people might ask, when will I start? Or how will I start? The answer is now, and it is by using your voice towards a greater development and awareness of the community. Remember that action doesn't depend if you are too young or too old, because it is not your age that will define your importance and capability as a member of the community. As a youth leader, participation in community mobilization is the first step, because your involvement as a community member in planning, implementing, and evaluating community actions will play a big role in achieving community development. It takes time to build full and meaningful participation to achieve a sustainable goal for the country. However, if everyone have a willingness and a true commitment in achieving community development through positive influences and community mobilization, nothing is impossible.
In healthcare services, community mobilization is essential in linking health institutions to communities for promoting and providing better access as well as equality in healthcare. This encourages people to think about the interests of particular groups or communities. Through mobilization, communities become empowered and capable of addressing their own needs, which helps to achieve greater community sustainability.
Bat and Walkerman 2015 emphasizes community participation as a fundamental pillar in primary healthcare that has a wide range of benefits such as better health outcomes, equity, service access, acceptability, efficiency, and responsiveness where active participation of citizens from communities also takes place. In terms of community participation in healthcare services, this is beneficial to the development, implementation, and evaluation of health initiatives and has been found effective in integrating health interventions for positive public health implications as stated by Chua, Srivastava, Singh, Co et al. 2019.
Whereas this enables them to create plans for monitoring, assessing, minimizing potential health threats, as well as ensuring that health services, local actions, and different approaches meet the relevant interests of the citizens within the community in order to achieve sustainable growth. Likewise, it also allows people, especially the youth, to participate in the community by becoming more aware, responsive, and proactive in facing various issues that affects our community. In line with this, for the youth to become actively involved,
they must seize the opportunity to contribute through joining volunteer or outreach programs, community nonprofit organizations, and non-governmental organizations that can also support them in collaborating, planning, applying strategic process, setting goals, and enacting policies to aim towards long-term community efforts, as well as creating potential cohesion in the younger generations.
To effectively induce sustainable development within a community mobilization, participation, and engagement are integral elements needed. The people in the community have to realize and identify their problems through mobilization and participation of different groups within the community, accept and own their problems, and formulate steps to fill the gaps. Lastly, constant engagement of the people on the programs implemented is an important part to initiate the change. External organizations are only facilitators in community development. They are only there to guide and facilitate the community on the steps towards development. This ensures that the community is learning and is capable of standing on their own once the help from external organizations stop. Community engagement is defined by the Center of Disease Control as the process of working collaboratively with communities to address issues that affects the well-being of the people. It was emphasized that community engagement is a powerful tool to initiate behavioral and environmental change to improve the health of the people in the community. To achieve the desired changes in the community and improve the overall health and wellness of the people, different actions under community engagement is done, such as mobilization of resources, expanding of system of influences, and serving as catalyst of change in policies, programs, and practices. As a part of community development and improvement of health of the people, health services are being brought closer to the people. Free health services such as family planning and sexual and reproductive health care are offered to the people. However, stigma and lack of information are hindrances to the health services to reach the people. The role of the youth in the community is often downplayed. The youth are often branded as too young or inexperienced to initiate change in a community. In contrast to these beliefs, the youth is capable of catalyzing change in a community. As a member of the youth, we, for example, as medical technology students, are capable of community engagement through education. At a young age, the youth are capable of building connections with the people in the community to advocate development. Different organizations and local government units can work together with the youth to educate the people and eradicate the stigmas regarding the health services offered through campaigns, information drives, and seminars. The youth are capable of making an impact to communities by making the people realize that the gaps in the communities can be filled and would improve their health and wellness. Community engagement is not only beneficial to the community but also to the youth. Community engagement proves that learning is not only confined within the four corners of a classroom. Community engagement instills leadership and sense of public service to the youth, which is relevant to the future leaders of communities and possibly the country. Overall, community development requires effort from both initiators, the youth for example, and the community. Community engagement is a starting point for the community to improve their health and a turning point for the youth as leaders.
To conclude, health services are something that should be accessible to everyone regardless of race, religion, political belief, economic or social condition. And for the convenience of accessibility, health services are brought to the community, brought to the people living in remote and rural communities with an aim to provide and establish quality health service to all. The importance of having health services should be emphasized and reiterated, especially to the youth. The youth, as part of the future generation, should start to be involved in the participation of the community. As part of the youth, it is important to have a really clear understanding on how you can impact and help the community. Taking the initiative is an important step towards community participation. Taking the initiative to join community activities like volunteering could help us gain experiences that could be used to our advantages. As a youth who used to volunteer before the pandemic, I gained my experience by volunteering in orphanages and medical missions brought to my school as outreach programs. These experiences were beneficial as I got to see firsthand on the struggles of living in the orphanage. We got to help them with laundry and feeding the children. And on medical missions, I helped people by guiding them where to go next. To be honest, some of these roles are not really significant and could not really impact the people well. But despite these small and not so significant roles, it ignited my passion to help and to be involved in the community. As a future medical technologist, taking part in health services in our community by helping them with simple tasks like guiding them where to go, registration, blood pressures, and evaluation forms could be a huge impact. Today we experienced a pandemic. Everyone is in a tough situation, but that does not stop good deeds. Despite being in a pandemic, people still thought of ways to help by being involved in the community pantry, or simply giving random things like groceries to random strangers could make their day and have an impact. It can be seen that the pandemic does not stop community participation. With health services being a huge struggle because of the pandemic, being creative like having informative webinars or allowing the social media platform to create informative posts could impact and allow community participation despite having it online. As part of the youth, we should start to create an impact to our community, to initiate change, and to break the stigma that the youth are inexperienced or too young. You can never be too early to start community participation, and you can never be too old nor too young to initiate change.